we were thinking we want to not to exhaust people tonight. We have some very exciting speakers and some topics that are going to be very important to many of us.
So we're here tonight at the Hellenic Medical Society, and my role as a chairman for these scholarships, my name is Sotirios Georgiopoulos. I am the head of breast cancer for U.S. Medical Affairs for Celgene Corporation, but my role here is to be able to help our youth and provide support for them.
It's my pleasure to talk today at the behest of the Hellenic Medical Society. My lecture will present revolutionary changes that are occurring in the field of gastroenterology. Essentially, endoscopy is moving beyond simple gastroscopy and colonoscopy to what can be termed surgery done through natural orifices such as the mouth, the anus. This allows surgical procedures to be done without any external scars, which avoids the pain, associated infection, and morbidity of traditional surgery, and also can be extremely minimally invasive, removing tumors and doing procedures while preserving the stomach, the esophagus, and other GI organs. Unlike traditional surgery, where often part of the organ is removed in order to achieve enough exposure to remove a tumor, say. So it's my honor to present these revolutionary changes today at this Hellenic Medical Society meeting.
The first speaker that I would like to call up is Dr. Stavros Stavropoulos. He has been discussed many times in our meetings and by many of the doctors that know him as not only a very bright doctor, but also very cutting edge. And we've asked him to come tonight to tell us specifically, the topic is called The Gastroenterologist as Surgeon, the New Era of Endoscopic Surgery. Dr. Stavropoulos.
And I have to say, these are technically demanding operations. The reason that we tend to be consistently at the front of this procedure is that they have a pretty long learning curve, okay? Other centers will follow, but it requires a few years of training to get there. And this shows, how much training. We started doing ESD in 2004. We're the only ones in the US. 2005, we started doing it in humans. That was in animals. 2008, we started taking those deep muscle-based tumors. 2009, we started BORM, and it took another 2 years to start doing this full-thickness resection of tumors. So, as Hippocrates said, life is short, but the craft is long, opportunity fleeting, experimentation perilous, and judgment difficult. It takes a long time to acquire and perfect one's craft, but one has but a short life to do it. We do our best to train other gastroenterologists. We have a yearly course bringing all the global leaders in this, which unfortunately are still mostly in Asia. As you can see, China, Japan, coming to winter to perform live cases and to train people on hands-on labs. And I'll leave you with two happy poem patients, one that came to Winter from Costa Rica. When she went back to Costa Rica, now she's eating normally, her achalasia is fully treated, and sent us this picture. And this is a boy from Kuwait, that this is the second day after his surgery. I can tell you, no laparoscopic health patient looks that good the following day. So, thank you very much.
I'm Jack Sotorakis. I am the Vice President of Physician Clinical Services and Quality Improvement for Catholic Health Services of Long Island. Formerly, I was the Chief Medical Officer of St. Francis Hospital in Roslyn, New York. This evening, for the Hellenic Medical Society, I'm going to be speaking on the transitions in healthcare from volume healthcare principles to value-based healthcare, which basically means that from the fee-for-service model that we've all experienced in the United States over these years is changing to an era of accountability with certain performance measures, as well as a reimbursement based on these outcomes and performance measures, as well as cost containment.
Certain measures, it's a process of care. That's what we have to be attentive to. And if we indeed put in these correct processes of care, we can reduce complications, we can reduce hospital-acquired pain, we can reduce the errors. And you're right, we will never be perfect, never. And to err is human, there's no question about it. However, review your conditions, reform and reorganize your processes of care so that these mistakes do not happen again. The second part is the medical malpractice issue that you referred to. And that issue is interesting because there has to be medical malpractice reform. There's no question in our mind about that, and all of our minds about that. And yes, again, nothing is perfect, and again, the error is human. And it happens in this fashion, but nonetheless, if we are attentive to documentation, to correct processes of care, I think we will reduce errors that we're referring to, and again, provide better care to our patients.
This evening I will be speaking about some of the current legal issues that are affecting medical practices today, including privacy and HIPAA, overpayment requirements, and electronic health record requirements that are all new and changing in today's environment.
Current legal issues in medical practice. What I'd like to cover this evening are just 5 topics. There's the recent developments with the 60-day repayment rule. Stage 3 meaningful use requirements have recently come out. There's, as was alluded to earlier, the implementation of the merit-based incentive payment systems. I'll talk a little bit about that. There's some HIPAA updates that you'll be interested in, and the new START regulations have just recently come out as well. So the 60-day repayment rule, what this is it was implemented as part of the Affordable Care Act, and it requires the return of any Medicare or Medicaid overpayments once they become identified.
It's very difficult to get young people motivated, and when they do have it, you look for the reasons. And I can tell you, some of them are very much interested in future diseases, illnesses, and whatnot. I saw one that also touched my heart where I think it's the son of a surgeon, and he looked up to his father, emulates his father, and I find that extremely warming, considering I have 2 boys, and one day they'll say the same about their father. So my one comment I would say to all 3 of you is, bravo, you've done extremely well, and I know you will make us quite proud in the future. And like I said, if you don't become physicians, we want the money back. For our Doppler Scholarship, Anastasia. We have Alexander Orfanos from Dartmouth School of Medicine, the Geisel School of Medicine, who's receiving the Dr. Anthony Vasilis Award. Sideris from NYU School of Medicine, receiving the Dr. Polybios Kourilos Memorial Scholarship. And of what I understand, Adormaiki is not here as well, but her sister, who is also getting an award, Myra Jabelis, will be able to receive on her behalf the HMS, the Hellenic Medical Society Scholarship. Wonderful. And we have 2 research grants, so I think Myra, we came up at the right time. And these 2 research grants are from the Leonidas Lodzounis Research Fund. One is from Myra Chavelis, who goes to Penn State College of Medicine. Another round of applause for her. And Christos Mouzakidis for the Stavros Kartofridis Research Fund. Obviously, we have some very wonderful students. We had 3 high school students as well as some medical students who received some incredible awards for them to be able to take with them. But what I really admire about them is the amount of work that they've done and the merit that they actually deserve for these awards is tremendous. So what we like to see is our youth growing, especially in our Greek community, and it's also the beginning. So this is making us very proud to find that our youth are model citizens and future physicians, especially from the Greek community are doing extremely well and will be the future for us. And I think Hellenic Medical Society has done an incredible job of being able to support them and hopefully one day building a network for them. So we hope to see them in the future, and we hope to get to see you as well at Hellenic Medical Society. Thank you.
This is our presentation and conclusion of the scholarship ceremony 2015. What a night. We have multiple scholarship recipients from high school and the medical levels that were outstanding students. We had 3 lectures tonight which were of outstanding caliber, and what a night. Thank you for being with us. We hope you learned something. As always, thank you MGTV for picking us up, for being with us, for being a part of our family, and for documenting our history. Happy holidays.
MGTV USA. Οι δραστηριότητες της ελληνοαμερικανικής κοινότητας με βίντεο και πλήρες ρεπορτάζ. Επισκεφτείτε την ιστοσελίδα μας mgtvusa.com.